Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and I am here today with my nosiest of nosies co-hosts, Dr. Millicent Rovelo, because we are talking about noses.
And I am quite nosy.
When it comes to noses,
actually.
You are.
So this is the podcast, what you need to know if you're thinking about having a rhinoplasty, short and sweet, down and dirty, what you need to know if you're at all thinking about it.
No rants.
Is this a no rant?
There's a no rant
podcast.
zone. This is a rant-free zone.
Listeners, we are keeping Dr. J. Calvert in check here.
I just want to say there are many other podcasts that we've done about having a rhinoplasty. There's Intro to Rhinoplasty, Intro to Primary Rhinoplasty. There's Rhinoplasty 101. But this one is really for people to get the information they need if they are thinking about having a rhinoplasty and they're just kind of out in the world. They're like, I think I'm going to get my nose done.
Right. What you kind of need to know to cover the basis. So why do you want to have a rhinoplasty? That's question number one. Usually it's because patients don't like how their nose looks. Sometimes there's a functional component to it. They can't breathe. They have a deviated septum. These can all be addressed at the time of the rhinoplasty. If that's what you're coming in for specifically, that's a functional rhinoplasty. That's a different story. We're talking about rhinoplasties that are changing the way the nose looks because you want it to look different. And
I do want to say that, again, with the typical reasons people come in are ethnically diverse.
Very.
So if you are a Caucasian person or a Hispanic person, you may be coming in because you have a hump that you don't like. You may have a droopy tip that you don't like. If you're Asian, you may like that your bridge is too low and want to build it up, or that the tip is too wide and the nostrils are too wide. So it's anything that if you're African American, it may be that you want more of a bridge and you want less nostril show. You want to have narrower nostrils. Every ethnicity has its sort of complaints of what looks off to them and what will make them more attractive. And the goal is, after the rhinoplasty, yes, your nose should look better, but it's not the nose that you're operating for. You're operating for the look, your overall appearance, because the nose totally affects how your eyes look, how your cheeks look, how the length of your face. It's such the centerpiece of your nose, and we operate on it so you don't look at it.
So you don't see it. The goal is to create a more harmonious appearing face. And how we do that is how and why we do it. That's the whole basis of rhinoplasty. So when you're coming in and you are talking to your surgeon about a rhinoplasty, let's talk about the different ways that they can potentially do it. So usually the first question that's asked are you going to do it open or closed? So an open approach means that there's an incision on the columella. The columella is that center piece of your nose in between your two nostrils, and an incision goes right across the middle of that, and then the skin is lifted up. You're looking right at the inside of the nose, and you can do your rhinoplasty there. A closed rhinoplasty means that the incision is on the inside of the nose. So in the mucosa lining of the nose, you make your incisions there and then access the nose internally.
I almost just went on a rant.
I know.
You know why I was going to do it? Because I was I'm having a scarless rhinoplasty. I'm not going to rant. I'm not.
No rant.
I'm not. But people do advertise the closed rhinoplasty as a scarless rhinoplasty, which is complete BS, because there are scars inside of the nose that can still be visible, because you can still have problems with. So I don't like when that term is used, because scars are scars. Yes, you don't see this scar, but I will tell you that in terms of the advantages, what you want is a surgeon that can do either. If you go to a surgeon and they say, I only do, then I think you're talking to a zealot, or you're talking to somebody that's limited in their abilities, and you may want to just kind of, I don't know that that's a bad thing per se, but you may want to just kind of revisit, because I tend to tailor my technique to the patient's needs. I do open, I do closed. I do more open rhinoplasty in primary rhinoplasties than I do in like secondary, the revision rhinoplasties. And I still do plenty of closed rhinoplasties for people having their first rhinoplasty, but I tend to do more closed in my revision rhinoplasty. So I tailor the technique to the patient's nose and the result they're trying to get.
So when would you do a closed versus an open? And so to be clear, we're only talking about primary rhinoplasty.
Today we're just doing primary.
Primary means you've never had a rhinoplasty before. This is your first one. Revision rhinoplasty, we have a whole nother podcast set for that. But for a primary rhinoplasty, someone that's never had a rhinoplasty before, when would you do closed versus open?
I tend to do a open rhinoplasty when there's a lot of tip work needed. If I need to do tip suturing, if I need to balance something at the tip, if I need to do more than 3 or 4 moves to the tip of the nose, then I'm going to open it because I need to get that right to make everything come together. If I just need to adjust certain things with the tip, maybe I need a little more tip definition, maybe I just need it rotated, then I'll do everything endonasally. I can do any nose endonasally. I can
endonasally
means closed. I can do any rhinoplasty anyway. I've done over 5,000 rhinoplasties now. I'm skilled in the art. I can do it however I choose to do it. My goal is to do it the way that I'm going to get the best result, that I'm going to max out my abilities for that patient, because every patient comes with a different nose and a different set of desires and different obstacles to getting that ideal nose. And so you want to custom tailor it. It is really key. And you want to have power in that your technical abilities are not limited to, I only do it this way.
Right. And there are benefits.
That's a mini rant.
I know. I'm going
I'm
to let it slide.
But that was a mini rant. I'm going to let it go.
That you only get one, so that was your one.
Done.
So, with the thought of closed versus open, there are obviously, like you said, benefits to doing open or closed. But one of the main benefits that people say for the closed is that it's a quicker recovery. And so that is true. If you have an open rhinoplasty, you're going to be swollen longer. So there's going to be more swelling in the nose. That's going to take longer to come out. So the results are going to take a little bit longer to show themselves. Whereas with a closed rhinoplasty, there's less swelling. You're going to see that result a lot sooner. And so the recovery is a little bit less. So that is a benefit of the closed, but it's not the only reason that you should do it. Like you said, it's based on what the patient needs. And that's the benefit of the closed. If you can do it, then you get a shorter recovery. But what do you say to the patient? So I guess the question is, and then we'll talk about, how patients recover. When a patient comes in and they just say they don't like their nose or they don't like something about their nose, how do you get down to what the best nose is for them aesthetically? Like, how do you decide, this is what your nose should look like? Do you ask them to give you pictures? Do you ask them to describe what they want? Or do you just say, I got it, I know what you need?
No, I want to hear from them. I mean, I can usually tell why they're there. There's a lot of, I've done a few of these. So they're common complaints that they know that they'll look better. They've seen pictures and they've usually seen rhinoplasties where they've seen somebody who had their nose. A lot of times it's somebody on my website. They're like, there's a patient on your website who looks exactly like me and I want that. And I like what you did for them. And so that's always helpful for them to bring their inspiration pictures. And bringing photos is key. It's really important.
Helpful.
It's great. It's not necessary. You can say, well, I love your work. Do your worst and make it amazing.
Yeah.
Which a lot of people do. They're just like, I'm not going to tell you what to do. You know what to do. So do that. I love the nose on your website. I love what I see on your Instagram. I want that. That's why I'm here. I saw, Susie Baker and she had the nose done by you, and it's amazing. So those are the sort of the common ways people wind up in my office. But yeah, bringing photos is key. Being able to articulate, I don't like the hump, the tip droops, and it's too wide. That's sort of a great way to be able to say, and then this, as the surgeon, I can go, oh, all right, well, yeah, I can see that. And then typically what I do is I draw a picture. I'm going to buy the imaging thing now for the fellowship. We train residents, we train fellows, but, for me, I always draw the picture. And I draw their nose. It doesn't take me long. And, I usually draw their nose and say, is this your nose now? They're like, oh, my God, that's exactly it. And then I say, this is what I would do. And I show them that. And if they say, I'd like it a little bit lower than that, or I'd like it a little bit more this or a little more that, then I adjust it for them and we agree on it. And I sign the picture. And I say, now take a picture of this. And that's how I do my digital imaging, because when they take the picture, now it's digital.
Now it's digital. There you go.
But that discussion is really key because it's a back and forth. And I just don't have a whole lot of people who say, well, I wish it were a little more this way or that way, because it's pretty clear when I draw the picture what I'm going to do. And in the setting of all those other rhinoplasties on all my other social media and the website and everything, it kind of comes home for them what's going to happen.
Right, and that's the thing. Like, you can go to 100 different plastic surgeons, and you may get 100 different results because every plastic surgeon has a different eye for what they like or what they want a nose to look like and what in their hands they can do. So that's why, again, going back to the befores and afters, choose a surgeon whose afters you like because that's their style and what they'll probably do for you. Not to say that you're all going to get a cookie-cutter nose, but every surgeon sort of has a different aesthetic. Some like them a little bit bigger, some like them smaller, some scoopier, some tinier. So just look at the afters, and if you like what you see from one surgeon's work versus another, then that's the surgeon for you.
The best way to find a rhinoplasty surgeon is to look at the before and afters, or to get a referral from a patient. We've done a bunch of podcasts about the way that things get marketed, and a lot of times it's a fairy tale. I mean, I've seen people market afters with filters on. I'm like,
you got your one rant.
All right, I'm not going to do it. I know this is a rant-free zone, and I'm not ranting. I'm just saying there are surgeons that market their results with filters on. Okay, and that I think that is total BS. I won't rant about it. You can go to those other podcasts and you can hear the rant if you would like to. And I invite you to do so because they're quite good. But the reality is you want to really like the before and after photos. And then when you come in, you want to make sure that you're on the same page. That is really important. We want to, as a surgeon, I want to be able to say, I hear you, I get it. And then when I'm in the OR, I can do that. And we make meticulous notes. I have a scribe who writes down everything we talk about, so nothing gets missed. People are always like, "Are you writing this down?" I'm like, "No, she is."
No, she is.
That's why I have.
That's why she's here.
Our incredible scribe Adira, who helps us, and that makes it such a big difference for us because it really does allow me to spend my time communicating, and really getting feedback from the patient, and then obviously the exam is really important. Everything's important. Rhinoplasty is a game of millimeters. It is, is the tip just right, or is it a little too narrow? Is it a little too wide? I mean, all those things come out in the nuance of the communication between the doctor and the patient. And I really believe that, I am an artist, and then as an artist surgeon, you have to be able to translate the dreams of your patient into a nose. I mean, it's really key. Into it,
yeah. Got to be able to translate it into an actual surgery, which is where the surgeon aspect of it comes in. So hopefully you've come in for your consult. You've spoken about, what you want. You've decided on a technique and a plan and a post-operative result, and then you come for your surgery. The surgery is something you come the day of. You can go home the same day if you have someone taking care of you. You can go to an aftercare facility. But after surgery, you're going to have a cast on the outside of your nose, and you're going to have some splints on the inside. Splints are these silicone splints. They have an opening in the middle so you can breathe through them. And both of those are typically kept in place for about a week. Sometimes the internal ones are longer if there's been more work done internally on the septum. But the splints and the cast are kept in place for a week, and then in a week you come back, all of that's removed. I would say the first couple of days, there will be some pain and discomfort. It's not awful. It's definitely manageable, especially with pain medicine. And by a week, from a pain standpoint, you're definitely feeling fine. But those splints are going to be bugging you, and you're really going to want the splints out.
Yeah, and Dr. Rovelo, you sound like you're speaking from experience.
I'm speaking those frickin' splints. I can't stand them.
You and Stepien both said that.
I hated those things.
It's on, I think Stepien's is on the TikTok. You could take a look at it. But he kept his very clean, and he was very proud of it.
He was. I could not. Mine just kept getting gunky. So that's the thing. Sometimes, blood will get collected in them, just secretions, and so they can get clogged up, and it's difficult to breathe. And even when you try and flush them with saline and water, they just don't flush. So when that happens, you go back to your surgeon and they can flush them out for you and clean them out and suction them out and make you feel a lot better. But
one thing, though, we don't pack the nose. People always ask about packing. There are still surgeons in today's day and age of 2023 that are packing the nose with gauze. And I only pack the nose once every 12 years for somebody that just bleeds too much, I have to put some gauze in there and pack it. That's very, 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 very rare.
Very, very rare. But that is one of the things that could potentially happen. So when you're talking about a surgery, you always got to know, like, what are the potential complications. In that first week,
Bleeding.
It's going to be bleeding. And it's very unusual, but every once in a blue moon, someone just throws a blood clot or something comes off or gets loose, and you have a massive bleeder. You call your surgeon, they come in, they fix it, and usually it's something they can do there in the office. But that is a very, real potential complication.
It's very rare. I used to tell people like it happens a lot, and I think, I'm going to knock wood right now, but it does happen once every 4 or 5 years that somebody bleeds a little more than the family's comfortable with. I said, come into the office, let's take a look. Maybe I'll put a little gauze on one side or something. Right. It does happen because, you're cutting bones, you're doing all kinds of things to the nose, and it's a high blood flow area.
Right.
There's a lot of vessels that feed the nose. I mean, anybody who's broken the nose will tell you they thought they were going to bleed to death from their nose, which, by the way, I've never, ever heard of happening and doesn't seem to happen ever. But it can be scary.
It can be a lot of blood. So that's probably the number one thing that could potentially go wrong in that first week. And then after the splint comes off, then it's a waiting game. It's going to be swollen. It's going to look a little potato-ish. You'll be able to see a difference, especially if you had a large hump or you had a very projected tip. You're going to see the change immediately. But in terms of getting the swelling out and really seeing the underlying shape and construct of the nose, that takes a few months. If it's a primary rhinoplasty, 4 or 5 months to really get its final shape, and then even up to a year. If you have thicker skin, it's going to take a little bit longer for that to come in. But the bruising, the severe swelling, that'll come down in about 2 to 3 weeks. So if you want to go out and have dinner with your friends, 3 weeks-ish, probably be good. But that's not going to be your final result.
Not even close. And that's what we always say. You'll be restaurant ready in 2 to 3 weeks.
Right.
Which means you can go out and have dinner and not feel totally uncomfortable.
Yeah, the waiter won't, look at you weird.
Yeah, so I tell people too, and this has happened many times too, is after 4 weeks, people look pretty good. And like for my actors and all that, they go get new headshots. And I'm like, no, you're going to look different. It's still really swollen. It's going to wait till at least 4 or 5 months to start thinking that this is the time to take photos, because it will get better and better, and it should evolve into something really nice, and you should be really happy with it over that first year. And that's kind of how it heals. And the timeline, people always ask, when do I get back to exercise? 2 to 3 weeks, you can get back to doing the gym. You can go. I don't want you running, but you can get back to doing some curls and some tricep kickbacks, some squats. You can do the elliptical trainer. You can do nothing don't run on the treadmill, but you could do the recumbent bike. You could do something where it's no impact and you're not bouncing your nose around and you're not going to, knock off a clot and bleed, which is what I'm concerned about.
Which can happen up to 3 weeks. So I would say up to 3 weeks, nothing heavy, no heavy lifting, nothing where you have to strain too much. And really importantly, nothing that's going to break the nose, potentially break it. So if you,
jiu-jitsu is a bad idea for the first 3 months.
I wouldn't go during the middle of your ski season. The bones are very fragile. We've broken them during surgery. And so until they are fully healed, which is 6 weeks plus, they can easily break again. So that's where you have to be really careful when you're walking around your house at night, that you're not running into door jams. If you have small children, that you're not holding them on your lap and then they're headbutting your head. Definitely seen that happen. So you have to just be really mindful of your nose and what's coming at it, because it's easy to damage it and break it and bump it and potentially hurt your rhinoplasty in that initial 6-week period. Once you get past 6 weeks, you can be a little bit, less cautious. But for that time period, you just have to be really careful. And then you got to stay in contact with your surgeon. We say this all the time. You got to follow up, because you might think everything's healing well, but then when you come in, we can recognize something like, oh, hey, did you notice this is a little bit off, or this needs to be adjusted, maybe a little injection here, a little bit there. Oh, we need to do some nose cones to open up the nostrils. There are things that we are keeping an eye out on during your recovery period that are very important. So certainly do your follow-ups.
Yeah, following up is key.
Taping. We didn't talk about the taping. That's something important to do.
Yeah, well, we do like you after surgery to tape. But I wanted to mention for my out-of-town patients, because I have a lot of people that fly in for surgery. those follow-ups by video conference are key. And then I will say you do need to come back. And it's typically at least once, sometimes twice, where you have to come back in person because I have to look at certain things in the nose that just are not, they're not available through a visual inspection through a camera. It isn't the same thing. And, I have a lot of friends around the country who help me with rhinoplasty patients, and they are incredibly helpful and good to do so. And because they're my friends, they are, willing to see these patients of mine that are having a little trouble when they're in, Atlanta or Boston. I'm just, to give shout outs to, John Connors and Rafi Dirsarkisian. I mean, these guys are just amazing, and they have helped me tremendously with patients. Phil Dawa in Dallas. I mean, so there's a lot of people that really step up if you're having trouble. But the point is, if you really need to get on a plane and come back and see me, and they don't like to do that if they don't go, but I got the kids and I got this, and then let me see if I can get somebody to take a look at you, because there are certain things that you just can't appreciate through a camera.
That you can't, and the patients might not know that it's an issue. So if you follow up, that's super helpful. As we said earlier, once the splint comes off, you'll be taping at night, usually for a few weeks. You might
video on YouTube
for that. Nose
Dr.
cones,
Calvert nose taping. It's really good.
It's right there.
It's good, easy.
All these things that we can help you with in the post-op period. But you just got to follow up.
Some important notes for the parents, because I do a lot of teen rhinoplasty, and there is a podcast called Teen Rhinoplasty. I would highly recommend listening to that. It's helpful. And also we have a post-op instructions for rhinoplasty patients podcast, which is also key. But you need pain control. The parents are freaked out by the fentanyl craze, and you're getting these, you will need some narcotics for a day or two at least, and you're getting them from reputable pharmacies. They don't have fentanyl in them. Don't worry. These are like normal drugs, and I'm telling you, the parents are so freaked that they give their kids a Tylenol, and and the kids are miserable. I'm like, please medicate your kids. Give them. They need these drugs. It hurts. We cut bones. We moved things around. This is a painful surgery, kind of. And it's not painful for long. But for the day after surgery, anybody who's had surgery can tell you, you need some pain control for a day or two. And then it eases off, and it's okay.
No one's going to get addicted on 2 days of pain medicine.
No, not at all.
It's not a thing.
And you can get over to, everyone worries about Advil. I get people on Advil very quickly. Advil doesn't cause the bleeding and bruising that aspirin does. Aspirin is a different drug than Advil. The ibuprofen is not going to give you the bleeding and bruising. Aspirin will. Yeah, aspirin, the legit salicylic acid aspirin, will make you bruise like somebody ran you over with a bus. You can't take aspirin around surgery. However, the Advil you can. And, I've had sinus surgery myself, and I took 1 or 2 Percocet for a day or so, and then I went to Advil, and it was fine. So, from my own personal experience, I am a big boy, and I played rugby, so I probably have a higher pain tolerance, but still, for the kids, give them pain medicine. They need it.
Yeah, they'll be fine. They'll thank you for it, and you will thank you for it.
You'll be very grateful that your child is resting easily and comfortable after having this, operation, which, just a quick side note for teen rhinoplasty, it is one of the most rewarding experiences as a surgeon to have teenagers come in and say, this operation has altered the course of my life, and I can't thank you enough. And the parents say the same thing. And it's really so powerful and so wonderful. It makes what I do totally worth it.
That's great. And we do. Check out the Teen Rhinoplasty podcast, because it's a good one if you're at all thinking about it.
Yeah, so that's kind of how it works. I'm not sure what else. I mean, cost. We always talk about cost. It's not cheap.
It's not cheap, and it depends on what part of the country you're in, what zip code in LA you're in, depends on surgeon experience. So it's very, very variable. Yeah,
the range of a rhinoplasty that I've heard in the last 6 months has been anywhere from $8,500 up to $30,000 for a primary rhinoplasty.
Yes, that is a very accurate range. And that's just in the Los Angeles County area.
I think in New York it may be more. I think Manhattan has gotten even more expensive than that now. I'm not sure. And And there are outlier surgeons. I've heard of surgeons charging $75,000 for a primary rhinoplasty. They're highly desired people that have fancy planes and things like that. So I mean, you can pay more. I promise you. I think in 90210, if I think you get closer to 90210 and you get closer to 10021, the prices go up.
Yeah, I think in the 90210 Beverly Hills area, a primary rhinoplasty is going to be anywhere from $15,000 to $25,000. Elsewhere, it might be closer to the $8,000 to $10,000. I think is a very reasonable range.
Yeah, it depends. If you're in Toledo, Ohio, it's way less expensive than Beverly Hills or Newport Beach or San Francisco or New York City. I mean, those zip codes are expensive.
Right, and it's just because it costs more to live there. But still, usually a higher price means that someone's had more experience. They do this a lot. But still, just check out the befores and afters. Make sure you like their results and that you're not just paying them for the sake of paying them, but that you actually like it. Maybe you have a not a lesser surgeon, but someone who charges less, but you like their results more, then that's your surgeon.
100%.
Don't necessarily say just because they're the most expensive, they're the best. They probably are pretty close to the best, but not necessarily.
Yeah, I think there's a correlation because if the results aren't awesome, you really can't charge a lot for them.
You really can't. People will not tolerate that.
Nope. I mean, I have people that fly in for me to do these operations and pay what I charge for it because they want the reliability. They've seen, he's done more than 5,000 rhinoplasties. He's been the president of the Rhinoplasty Society. He speaks at all the meetings. Look at these before and afters. I'll go there. I think I'm stacking the cards in my favor.
Yes.
There's going to be a premium. I'm going to pay for it. You don't have to do that. There are people that are, 10 years in practice that, were trained by me that are incredible rhinoplasty surgeons, and they don't cost half of what I charge. So the most important thing in that situation is that you have good communication with the surgeon and you like the before and afters on the medical before and afters, not the, fancied up, I'm out at the club selfie before and afters, which are 1,000% BS. I won't rant. I see you looking at me. I see you. The selfie at the club, but afters drive me crazy. That's my rant. I got a little bonus rant there. Anyway, just look at the before and afters on the website. Make sure they're, reasonable medical before and afters. I admit my lighting is sometimes wacky too, and it's hard because I take pictures in my office. And it depends if it's 1:00 in the afternoon or 4:00 in the middle of winter, or if it's, it just that makes it very hard. But I'm going to try to standardize that by getting this new system for us and see if I can't get, very consistent lighting, very consistent before and afters. But they should be reasonable. And video really counts. That's why I like to put up a lot of video of my patients, because then, you can just look at them then. Or They can look at you when we're talking here and say, well, that looks okay. I guess that's good. But, yeah, I mean, I think the experience is key, and you want to know what's going to happen. So hopefully this podcast is helpful for that. Listen to the other ones that we've recommended. And call the office of your surgeon. I mean, the people there will be able to talk about it. Like in my office, everybody's well-versed in what goes on in rhinoplasties, facelifts, and breast surgery, because that's what I do the most of. And if you call the office and the team seems to know what's going on, that's usually very helpful. Right.
But it doesn't replace the consult. So Come in, talk to the doctor, get your questions answered, and book your rhinoplasty.
Yeah, get it done. It's powerful. I had one kid this year that it just made me cry. It's she was telling me what it's done for her. And, it's funny too, because her father was almost he just couldn't believe that he'd admit that it went so well for her. It was just I got to hand it to you. I mean, she seems to really, she seems like she likes the result. She's like, I love it. She's like, I don't like this result. I love it. It has totally changed my life. It is amazing. I can't even believe, she came out of her shell. It was such a, and it still was her. She didn't have a nose job, She looked like that, teenage girl that needed to have the problems with the nose, which were really detracting from her looks. And when they were fixed, just, the world opens up, they feel the confidence and I just love the way that I look, and it just makes them go out and interact differently, and it literally alters the course of their life. It's huge.
For sure.
So anyway, that's why I love what I do. It's just, it is a privilege to do it, and I love doing it, and it really makes me happy to see those, those kids just, blossom. And adults, I've had adults who said, I have a patient right now who's in her 50s. She's like, I've been waiting to do this my whole life. I haven't had the money to do it. I'm going to do it now. I want it done right. I need it to be amazing. And that's why I'm here.
That's it.
Get on the table. That's what I say. Giddy up.
Well, I think that's it. I think we hit the highlights. And if you need anything more, there's a host of topics on the podcast.
Go to the websites. It's on the Instagram. Like, there's plenty of information. We do a lot of this, and it's a good thing. Well, with that, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.